attention accident victims.
I was hit by a car, that wasn't nice. Call 1-800-VICTIM-2. Have you a neck broke from a crash you didn't provoke? Call 1-800-VICTIM-2. Risking your life for a living, and when you fall, call 1-800-VICTIM-2. Call 1-800-VICTIM-2. Call 1-800-VICTIM-2.
Oh, are we live? We're live, okay. This is Samantha Renee reporting to you live. We interrupt your program to tell you of a disease that has struck worldwide. As of now, the situation in America is tragically grim. The same is to be said of other countries where violence prevails as people seek answers to the growing epidemic. A panel of the world's best scientists, doctors, and military officials have been working around the clock in the hope of a cure. In this country alone, the death toll has surpassed expectations. Thousands are waiting for a cure, and everyone has been affected. This just in. We will now show you clips from around the world. Viewers' discretion is advised.
The children's ward is filled with those struggling with the same medical crisis. This epidemic attacks indiscriminately. Most doctors simply can't spot it before it's too late.
These are, of course, the perfect conditions for an epidemic.
The global threat is not hypothetical. The report warns that they are devastating these communities now, yet the science and the coordination needed to stop them are utterly insufficient.
The situation is terrible. Inside the hospital, they're overcrowded. They're not overcrowded. It's beyond overcrowded.
This outbreak seems especially deadly. Fear is rampant. Aid workers are rushing to prevent the disease from spreading.
It is going to continue to spread.
Do public health officials think they can get this thing under control? It doesn't sound like it.
You know, I spoke to experts today, and they're extremely concerned. The effects could be devastating.
Today, the United Nations has launched an urgent appeal for more helicopters. The UN says 800,000 people have been cut off and can only be reached by air. And the government is warning about an epidemic.
These people are among the many millions across Pakistan relying on hit and miss aid for their survival.
There's a lot of chaos and people are very desperate to get what they can as quickly as they can.
Many say they don't know how they will rebuild their lives without help.
An outbreak of a virus in the Ukraine sent the country and its neighbors into panic. A cocktail of 3 flu viruses mutated into a single plague, possibly more dangerous than H1N1. 189 people have died. 1 million more are infected.
We don't know yet how widely it's spreading, and we certainly don't know the extent of the problem.
Quickly followed by outbreaks in schools.
We now know of hundreds of students who were sick.
Shocked by the number of children dying from the virus, some schools closed in an effort to prevent it from spreading. We heard from our nation's leaders. Some messages were clear.
This is obviously a cause for concern and requires a heightened state of alert.
Others confusing and quickly disputed.
I wouldn't go anywhere in confined places now.
Widespread outbreaks caused hospital overcrowding and isolation.
I feel just terrible, awful.
There is little known about this epidemic. The disease spreads rapidly, with every country having been affected in under 24 hours. As our nation holds its breath on what's to come of this devastating illness, we can only hope for a miracle. We will keep you notified as we wait for the official word. May God be with you.